What about those nurses who get pregnant? Like nursing is primarily women of childbearing age, and some of the nurses get pregnant. So from your experience, how safe is for a woman who either is pregnant or wants to have children to be on an oncology floor? Is there a way to work around it?
The Oncology Nursing Society, for example, has published those safe handling guidelines, and you can reference that publication by going to www.ons.org.
Mm.
Those guidelines are meant to help nurses work in a safe place so that the exposure is minimized, and it does take into consideration people of childbearing potential or those who are pregnant. And those cases do come up in the hospital. I have seen people who are pregnant work with chemotherapy over many of my years. And there are sometimes people who do take an alternative assignment because precautions that they have in mind in avoiding that direct work environment with hazardous drug.
Without having to necessarily leave or quit, but just be able to use other options during that either short time period where they are pregnant or temporary leave, but working either with non-cancer patients.
Well, I think about the workplace setting, because if someone works in a hospital, they may be able to work on another unit. If they're an infusion nurse and they're in a point in their life where they're going to become pregnant or they're actually pregnant, they may be able to have another role as well. Perhaps they could do phone triage, or they could be a nurse navigator. So the opportunities are there to continue working, in your childbearing time in oncology. And you'll see more than ever, there are so many roles for oncology nurses in the workplace, whether it's inpatient, outpatient, research, clinical trials, where you wouldn't have direct contact giving the medicines to the patient. You're still in that environment, the nurse's station. Nurses will be able to find resources. Their employers, their leadership can help them find those things. And those are good questions for people to ask if they're comfortable when they're looking at an oncology job.
Basically asking what that particular facility's rules are. It's good to ask those questions to know ahead of time of, is that actually going to be a good place for me to stay and they'll have options for me? Or will I need to be looking for an alternative place of work when that time comes for me?
Yeah, and it really depends on the setting the nurse is in. Are you in a large cancer center in New York City, or are you in a rural setting in the middle of, where the major cancer center is an hour away and you treat patients there? What are your options?
Life is a winding road, no telling where it goes.